Hi, I'm Dr. Brian Hutcheson. What is it that makes our office unique? It's a combination of our diagnostics, which include digital motion X-ray, diagnostic ultrasound, and an examination of you individually. Combine that with our treatments, which are a combination of very specific upper cervical chiropractic care, whole spine curve correction with a focus on cervical curve correction, dry needling, and rehabilitative exercises. Rewind to our diagnostic procedures, and digital motion X-ray is a way to assess the spine during motion. During these examinations, we obtain both qualitative and quantitative measurements on exactly how your spine is functioning. A qualitative measure may be that when you jut your chin forward, that only your upper neck is moving. A qualitative measure may be that when you're bending or extending, that your neck is moving mostly at the very upper segments and the lower ones are stuck. Or we may see a qualitative measure showing that when you jut your chin forward, that you're really restricted because one of the bones is hitting another bone. The quantitative measures that we get are amounts of instability or overhang of the atlas on C2, and also how much instability you may have in other areas of your spine. We can measure those precisely down to 0.1 millimeters and quantify those into a report to help develop the optimal plan for you. Fast forward to the treatments that we utilize, and gentle, specific upper cervical chiropractic care is one of those things that I like to correlate to the master control box of electricity in your home. With a patient just yesterday, I was explaining that when you may have to change out a light switch or put a new ballast in, you may feel comfortable enough to do that on your own without hiring out to an electrician. However, when you have an issue that requires service to your master control box in your home, you're almost always going to hire an experienced electrician. And it's not only because it's up to a certain code requirement for your city, but if you make a mistake there, you could potentially cause a fire that burns down the whole house. So the upper cervical spine is kind of like that master control box. And it's very important that you gently and specifically set those bones in the right place to optimize the communication between your brain and your body. Whether it's spinal cord tension, cerebral spinal fluid flow, freeing up the jugular vein, taking pressure off of the vagus nerve, and the list goes on. The next treatment that we do is called curve correction, and it can go for anywhere in your spine. With the cervical curve correction and whole spine curve correction that we do at the office, we utilize a combination of therapies, but the primary one being weights, spinal weights that help rehabilitate the curvature in often record time and are really simple to use at home, so you don't need to rely on us for daily office visits, often for a prolonged period of time. We combine the spinal weighting with rehabilitative exercises that are designed to improve your spinal curve, to balance the musculature in your body, and to help support a more long-term and complete recovery from any abnormal spinal curve and the related symptoms. Dry needling is very helpful for anybody who's had a prolonged, insidious, or slowly developing injury, as well as a previous trauma that never fully healed. Many of the muscles and tendons end up becoming adhesed as if they're not functioning to their normal pliability, and even some of the tendons can have micro tears or fraying in the tendons. We're able to perform functional dry needling to help stimulate a proliferative effect in the muscles and the tendons and help bring healing to these tissues. When you combine the diagnostics of digital motion X-ray, diagnostic ultrasound, examination of the individual with treatments such as upper cervical specific chiropractic care, instrument adjusting to other areas, therapeutic exercises designed to not only restore your curvature, but bring balance and integrity to stop abnormal pulling, and functional dry needling to relieve adhesed muscles, tendons, and to restore connective tissue integrity, we have addressed almost every component of the whole person, bringing a comprehensive rehabilitation plan to life. So please feel free to check out more of our content, send us an email, and we'll be happy to reach out to you and schedule your first call as a free complimentary consultation. Thank you for watching.